Hi everyone, good morning. Thanks for being here today. My name is Zain Chagla. I'm an infectious disease physician based out of Hamilton, Ontario at McMaster University. Today I'm grateful to be joined by my esteemed colleagues from across the medical profession. Here in person we have Dr. Dominik Mertz, who's a colleague of mine at McMaster University, Dr. David Carr from the University Health Network in Toronto, and virtually Dr. Karl Weiss from the Montreal Jewish Hospital and McGill University. Today, we're going to review the efficacy of the federal government's border rules and restrictions. What impact did they have on COVID-19, and are they still necessary? Was travel as dangerous as it was framed to be? And finally, what are the lessons we can take from this pandemic as we consider planning for future variants of concern or other infectious disease threats? At the start of the summer, the four of us came together as a group to try our best to answer these questions, not to criticize, but go through an evidence-based measure of travel and its impacts, and create lessons in a learned report that can be utilized by decision makers in the winter, or if a new variant of concern arises, or in several years if there are emerging infectious disease threats. Pandemic policy is challenging, particularly at the start of a crisis, when there's very little scientific information and very little tools, confusion and fear. But as the science progresses and the evidence progresses, evidence decision-making becomes much more accessible. Today's key findings suggest that while border measures made a difference at the sense of the beginning of the pandemic in March of 2020, when much was not known and the disease was limited to certain areas of the world, in a post-vaccine and post-Omicron era, their impact on mitigating the spread of COVID-19 has been minimized. And that includes border measures such as testing, pre-departure testing, quarantine hotels, and other travel-related mandates. Omicron changed the pandemic fundamentally, and we saw a loss in a lot of protective immunity from vaccination and an infectious disease that was much more transmissible, making many of our measures much less effective. The science and evidence became increasingly conclusive that over the last few months that the impact of these measures was limited. And from what I understand, there is some discussions around the future of these measures ongoing over the last week. In sum, our research found that at the very best, particularly during Omicron, using modeling and other data from around the world, that the lockdown on Canadian borders likely did delay the emergence of Omicron, but by a very small amount, by a few days at best. The virus, and I think we all realize, is really spreading in our communities, and really travel as an industry itself is not necessarily the implicated industry in all of this. People are acquiring COVID in their own communities, in their own neighborhoods, in their own facilities, and that really is driving COVID transmission locally. At the beginning of the pandemic, the travel and tourism industry was singled out as being the vehicle which brought COVID into Canada. And I think, there is some truth to that. But I think once there was ongoing community transmission, as we dealt with Omicron, the travel industry really played no more of a significant threat than other industries within our community that we have to attend to at any given day. Our research, which my colleagues will highlight this morning, highlights that air travel falls very low for all activities threatening the spread of COVID-19, and everyday activities like public transit, going to work and school, visiting the grocery store pose more of a significant threat. We've talked a little bit about the claims, and I believe it's critical importance to go over them, and so I will pass it to my colleague, Dr. Mertz, to walk you through the findings.
Thank you, Dr. Chagla, and good morning, everyone. Maybe just to follow up on his points, as you all know, SARS-CoV-2 is a virus that's highly adapted to the human host at this point, and many variants have emerged over time, some of which more effectively than others, and those are the ones that were labeled as variants of concerns, and the latest one being Omicron that we have to deal with. I cannot talk about COVID without mentioning the vaccines. The vaccines have really been the cornerstone for our success to build population immunity, which allowed us to go back to a more normal life at this point of time because they provide great protection from severe disease. But as you all know, immunity, either from vaccines or from the natural infection, will not prevent future infections as effectively because the effect of the immune system is going to wane. And unfortunately, we have a virus as such that has all the characteristics a virus needs to stay. It will not be eliminated locally, not be eradicated globally. Despite that, we are in a very different spot than 2 years ago. With successful mass immunization and the treatment options we have, we are certainly in a much better situation now, and lockdowns is something we don't expect to happen again anytime soon. But let us drill down into some of those travel-specific pieces. So as my colleague already mentioned, international travel, and as such in particular travel by air, had been singled out as a high-risk activity with health measures put in place above and beyond of what we would have done domestically for the longest period of time, which added burdens to the airports, but also on the travelers. So let's look at aircraft transportation first. So first of all, a caveat. It's always difficult to tease out. Did a specific transmission occur pre-travel, lining up at the check-in, lining up for security, or post-travel, thinking about custom clearance, or during the flight? But if we are assuming all those transmissions occurred on the flight, traveling in an aircraft is probably one of the safest things you can do. One study estimated the risk to be 1 in 1.7 million being infected during air travel. Another study suggested that we see secondary cases in 0.5 to 1% of cases. That's lower than in many of our day-to-day activities that we do, like visiting a restaurant, going to the theater, or going to a gym. And as such, it remains a relatively rare or very rare occurrence when you look at the bigger picture. And there's no reason from that perspective to single out aircraft and that we would require any special health measures for aircraft travel if we don't have those for day-to-day activities. Now, with the travel by aircraft not being an increased risk, let's look at some of those measures related to international travel. Reality is that domestic health measures have been largely relaxed globally at this point. And if you're looking at the literature, the common theme for when you look at effectiveness of those travel measures is they do work, they do have an impact as long as you have major domestic health measures in place. So basically you're in a lockdown situation very early in the pandemic when we had that. And the second piece, when you think about effectiveness of any of those measures, is you need a large gradient in risk between that international traveler and the average person being at the Shaw Center today. Otherwise, there's no point in singling out those international travelers. And this being said, neither is the case nowadays for Canada and hasn't been for a while at this point. However, as my colleague mentioned, in the early days of the pandemic, evidence certainly suggested that with border restrictions, we were able to delay the peak of the first wave, and probably it also helped flattening the curve before it became more prevalent in our own community. But nowadays, with what I've said, there's at best a minimal effect on the trajectory of the pandemic today, and neither restrictions, advisories, testing has or will impact the spread of future VOCs. And I also have to say all those measures that we have had in place failed to prevent global spread of the VOCs. So bottom line, they were ineffective measures. And also to mention reactive measures, so again, beefing up your international travel restrictions, as we've seen with Omicron, they are always too late, because by the time we identify one of those VOCs, a successful variant of concern has already traveled internationally. Let's look at some of those specific measures, screening and testing first. So Most studies suggest that symptom screening, so basically asking for symptoms when you travel, identifies somewhere between 0 and 30% of those who are infectious, so highly ineffective. You're missing the pre-symptomatics and you're missing the asymptomatic individuals, and the latter probably increased during the Omicron wave and with more immunity that we are building. If you combine it with testing, you get into the range of 70 to 90% of all positives that you may be able to identify. And by positives, I mean infectious individuals. When we break it down to arrival testing, I was part of a study we did at Pearson Airport in fall 2020, where we tested more than 16,000 travelers 3 times. The majority of those who were positive, based on the estimated viral load, were probably not infectious at that point of time. On the other hand, we missed folks who only tested positive then 7 or 14 days after arrival, because they were probably incubating at that point of time. When we think about variants of concern, there's a large US study where they did voluntary testing and sequencing, and they picked up BA2 and BA3, so 2 of the subtypes of Omicron, first in travelers, days to weeks before it was first identified in the community. But it was only not identified, it was already there, and the authors concluded that by the time that they identified it, it already spread domestically. So wasn't able to prevent those variants from coming in. When thinking about pre-departure testing, the same study from the US, just as an example, 44% of flights from South Africa had at least 1 positive traveler on board, despite the fact that everyone over 5 years of age required a negative test to board the plane. And similarly, more than 60% of flights into Australia had positive wastewater in the aircraft, despite pre-departure testing. So it's inefficient. Doesn't prevent the virus from traveling, but prevented some travelers from traveling because they may have had an old positive PCR test, which then prevented them from boarding the plane. Now, with all of these approaches being unable to prevent VOCs from entering a country and lack of a significant risk gradient when you compare the countries at this point, VOC surveillance, so surveillance for variants of concern, became the latest justification for the random testing we are currently doing in Canada. I would say we have much more efficient ways to do that with less impact on travelers, which is wastewater testing, right? So bottom line for my part, before handing it over, is the testing we do, it's costly, it's inefficient, it's neither feasible nor justified to test every traveler, nor continuing to do random testing at this point of time in the current environment, what Dr. Chagla referred to as the post-Omicron period. Wastewater surveillance and sequencing of positive symptomatic individuals who currently qualify for testing will be sufficient for us to do the surveillance for variants of concerns and to feed that data into the international databases that are out there. With this, I'm handing over to my colleague, Dr. Weiss, who's joining us virtually for his remarks in French. Thank you.
Thank you, Dr. Mertz. Merci beaucoup à mon collègue Dr. Mertz. Alors, je me présente, je suis Dr. Karl Weiss, je suis microbiologiste, infectiologue, chef du service de maladies infectieuses à l'hôpital général juif à Montréal. Cet été, avec 3 de mes collègues qui sont des experts en maladies infectieuses ou en médecine d'urgence au Canada, nous avons regardé de façon très scientifique et donc de façon très objective les mesures mises en place au Canada pour les voyageurs. Donc, nous voulons dire que c'est un travail qui est avant tout scientifique et totalement apolitique, et c'est important de le souligner. Il faut revoir la dynamique épidémiologique dans laquelle nous sommes actuellement pour comprendre l'importance de ces mesures-là. En premier lieu, la COVID-19 est là pour rester longtemps. La pandémie est en train de partir pour être remplacée par une endémie, et nous allons donc vivre avec un virus que nous avons dompté jusqu'à un certain point et dont nous sommes capables aujourd'hui de bien comprendre sa transmission. Deuxièmement, tout l'aspect des variants est très bien surveillé et monitoré, je dirais, à l'échelle mondiale par plusieurs systèmes, dont le système GISAID, qui nous permet de déterminer quel variant est actuellement, je dirais, dangereux ou préoccupant ou que l'on doit surveiller. On s'aperçoit également que le variant Omicron est présent au Canada depuis le mois de décembre 2021 et c'est un variant qui a atteint l'extrême de sa sophistication pour être transmis aux humains. Et donc, on voit que ce variant-là ne veut pas laisser sa place et ce sont donc des soulignés de ce variant-là qui actuellement sont en circulation dans notre environnement. La façon dont on suit les variants à l'échelle planétaire nous permet d'échanger des informations avec les autres pays dans le monde et nous permet d'avoir des informations en temps quasi réel aujourd'hui. Par ailleurs, il faut comprendre que la vaccination a changé la donne de façon complète. Il faut reconnaître aujourd'hui, grâce à l'effort de tous, que le Canada est un des pays les plus vaccinés de la planète et nous avons probablement réussi une très bonne campagne de vaccination collectivement et socialement, en dépit de toutes les embûches que nous avons rencontrées. Cette campagne de vaccination a eu pour effet de limiter de façon importante la sévérité de la maladie COVID-19 et on ne voit plus dans les hôpitaux canadiens aujourd'hui ce qu'on voyait lors des premières et deuxièmes vagues. On est dans un monde complètement différent. Toutefois, cette vaccination n'est pas protectrice contre l'infection. Elle est protectrice contre la maladie sévère, on l'a dit, mais elle n'est pas protectrice contre l'infection. Et on sait aujourd'hui qu'avec un virus comme un virus à ARN, pour faire un parallèle, un peu comme la grippe, comme l'influenza, on peut se réinfecter de nombreuses fois au cours de sa vie. Troisièmement, on sait aujourd'hui que nous disposons de beaucoup d'outils thérapeutiques, donc de médicaments, d'anticorps monoclonaux qui nous permettent de traiter rapidement les patients et d'éviter des complications. Finalement, quand on regarde un petit peu ce qui a été mis en place, justifié à certains moments lorsque cela a été fait, et c'est important de le souligner, mais que dans notre dynamique épidémiologique dans laquelle on vit aujourd'hui, on peut se poser des questions sur l'impact et l'utilité de ces différentes mesures. On sait par exemple que tout ce qui concerne les tests a des limites de face assez importantes, la qualité du test, comment le test a été prélevé. Lorsque les tests sont faits dans d'autres pays, il y a des endroits dans le monde où la qualité des tests, la façon d'être fait laisse à désirer sur la valeur du résultat, mais aussi sur le fait que l'interprétation de ces tests peut parfois laisser à désirer et aussi le fait qu'on doit tester énormément de monde pour finalement trouver une personne positive qui est peut-être pas infectieuse au passage, qui pourrait tout simplement avoir du virus résiduel et donc qui ne nécessiterait pas un isolement en tant que tel. Donc, de mettre une politique coûteuse à cette étape-ci de test global pour les voyageurs canadiens est un problème, je dirais, qui, d'un point de vue scientifique, en limite l'impact et la portée. La deuxième chose, quand on va, par exemple, dans un aéroport à l'extérieur du pays, où les gens ne portent plus de masques, ne portent plus de moyens de précaution, et qu'on demande ensuite aux voyageurs canadiens dans un avion canadien de porter un masque, bien, on sait que les gens ont été exposés pendant de très nombreuses heures sur tous les processus de n'importe quel aéroport que n'importe quel Canadien ou Canadienne est capable de comprendre. Et donc, à partir du moment où on s'approche et on entre dans un avion, alors qu'on a déjà été exposé pendant plusieurs heures à des gens sans masque, l'impact de porter des masques devient à toute fin pratique négligeable. Il ne faut pas oublier non plus que tout l'aspect de la ventilation dans les avions est quand même est un environnement qui permet d'éliminer, je vous dirais, des virus de façon assez importante et de façon assez continue. Il en va de même au niveau des politiques de quarantaine dont on peut se poser aujourd'hui des questionnements et on sait aussi parfois qu'il y a eu certains problèmes sur l'aspect de la gestion de la quarantaine de gens qui n'auraient pas dû être et puis on l'a vécu même avec des travailleurs de la santé à certains égards. Tout ça pour dire que nous sommes dans une situation évolutive, dynamique, avec un retour aujourd'hui à une vie quasi normale, tant au point de vue social qu'économique au niveau de la société canadienne, excepté pour, je dirais, un point important qui est le transport, surtout le transport aérien, où on continue de garder des mesures assez sévères dont l'impact, l'utilité, l'efficacité ne sont plus là à l'étape de la pandémie que nous vivons actuellement. Et c'est pour cela qu'en examinant tout l'impact de ces mesures-là, le groupe d'experts est venu à la conclusion qu'il fallait revoir, comme on le fait souvent en médecine, certaines de nos pratiques pour pouvoir avoir, je vous dirais, le maximum d'utilité à ce que l'on fait. Et c'est donc un peu le contenu du document qui a été produit aujourd'hui et dans lequel vous pourriez voir des conclusions sur tout ce qui touche la quarantaine, les tests, l'utilisation des masques. L'utilisation des masques, on pense utile pour des gens qui, d'un point de vue facultatif, voudraient continuer à utiliser des masques. En d'autres mots, si des gens ont des facteurs de risque particuliers ou pensent être à risque de façon particulière, bien sûr qu'on encourage ces gens-là à utiliser des masques à leur propre fin personnelle. Mais l'utilisation universelle du port du masque à ce stade-ci, même si pratico-pratique, j'ai été un des premiers à le pousser dans mon environnement dès le début de la pandémie, de façon générale, pour la population canadienne, on ne peut plus le justifier dans l'environnement actuel. Alors, c'est un petit peu le propos aujourd'hui qu'on voulait vous présenter. Et sur ce, je vous remercie de votre attention et je passe donc la parole à mon collègue, Dr. David Carr. Merci. Thank you.
Thank you. Good morning. My name is David Carr. I'm an emergency physician from Toronto and an associate professor in the Department of Emergency Medicine. I'm a physician, not a politician, and I wanted to provide you with some concluding remarks from what the four of us have come to think after reviewing. After having worked in a Toronto hospital throughout the pandemic and spending the time to write this report, my colleagues and I, what we've concluded from this is one thing. Regrettably, the COVID virus is here to stay. Fortunately, with very high vaccination uptake amongst Canadians and emerging and new treatments available, the concerns that we had at the beginning of this pandemic about overwhelming the healthcare system are no longer with us today. As you've heard, we've been tasked to look at the federal government's COVID travel restrictions and how they sought to prevent variants of concerns. Studies have shown that these restrictions have failed to prevent the variants of concerns from entering prospective countries and may have only delayed the peak of the wave by about 3 to 4 days. More importantly, some of these travel restrictions aimed in an attempt to stop the variants of concerns coming into the country resulted in externalities that negatively impacted economically and the mental health of the citizens of this country. Over the last few months, there has been a discrepancy in the measures that have been applied to international travel and tourism, especially when we compare them to measures applied to other forms of transportation, like public transportation, and to public health measures in general. We understand and we have heard that changes may be coming and that there's consideration of changes to border measures. We are hopeful that the policy decisions are rooted in science and strongly take into account that mandatory arrival and departure testing, quarantines, travel advisories, and border restrictions are not necessary in a society is highly vaccinated and has access to readily available treatments. We want to thank you for being here today, for listening. We hope the government uses the current data and the findings of our report and reports like this one to follow science and not reintroduce measures that single out travel and tourism and that sector in the future. Thank you again, and at this point, we're happy to take questions from the audience.
Thank you to our doctors. If any journalists on the floor have questions, please come and line up behind the microphone. Following those questions, we'll move to the teleconference line. We will take questions from journalists who have joined us remotely. After you.
Bonjour, Boris Proulx, Le Devoir. Monsieur Weiss, vous pouvez peut-être répondre en français. Ces données-là ont été basées sur des rapports, des études qui, je crois, sont à la disposition du gouvernement du Canada. Pourquoi, selon vous, on est arrivé à d'autres conclusions de la part de la santé publique fédérale?
Je pense qu'il faudrait que vous posiez posiez la question à la santé publique et non pas à nous. Nous, on a regardé l'aspect scientifique, l'évolution des données, la situation de la pandémie, la protection apportée par les tests, le niveau d'immunisation de la population canadienne. Alors, je pense que c'est une question qu'il faudrait poser aux gens qui semblent interpréter comme ils le veulent les données. Il faut faire attention avec les données sur la COVID. Il y a énormément de données, mais on voit un petit peu ce qui est interprété par les autres juridictions dans d'autres pays. Et quand on parle avec nos collègues en maladies infectieuses dans d'autres pays, on arrive souvent aux mêmes conclusions, plus ou moins, sur ce qui concerne l'évolution de la pandémie.
Merci. Et croyez-vous que dans le passé, à un certain point de la pandémie, ça a été utile qu'il y ait ces différentes mesures-là mises en place, ou est-ce que vous croyez que rétrospectivement, tout ça a été complètement inutile? And perhaps I can just ask also my question in English. Do you think at some point in the pandemic, any of these measures were useful, or now that we realize that none of it was useful at all?
Je pourrais vous répondre en français très rapidement avant de laisser mes collègues répondre en anglais. Je pense que les mesures ont certainement été très utiles à certains moments de la pandémie et les mesures qui ont été mises en place au Canada ont permis certainement, lorsqu'on n'avait pas de vaccin et lorsqu'on n'avait pas de thérapie, d'éviter, je vous dirais, les conséquences importantes. Donc oui, il y a eu une utilité à ces mesures.
I mean, I think what's important to state is that we're forward thinking and we're looking forward, and the pandemic has completely evolved. I think that the measures that were applied at the beginning seem very reasonable to a lot of people. What we know now with the Omicron area of the COVID pandemic is that it's time for change. And we feel that time is ripe. We're not here to look backwards. We can only present the data and say that right now is a really good time to reevaluate what we're doing.
Cormac McSweeney with City News, and I'm going to follow up a little bit on that because I believe, Dr. Mertz, you were saying earlier in the pandemic when we had domestic measures like lockdowns, travel restrictions were effective at preventing the spread of COVID, but then it changed over time. So I'm wondering, can you tell us when exactly these measures started to become ineffective? Was it the moment we got our first variant in Canada? Was it when provincial lockdowns ended and there was more domestic spread? Like, when do you think these measures became ineffective?
So first, I would like to reiterate that it's mostly based on modeling studies that would suggest that you have an impact when those international travels that sort of get through all the screening, testing, quarantine, etc., aren't able to infect too many people. Because of domestic measures, they are effective, right? Once you have a lot of domestic transmission, it doesn't matter anymore how many additional cases are coming in through international travel. I don't think there's a black or white answer at what point. I think we kept learning throughout the pandemic. And when you're looking at the more recent modeling studies, they would suggest what I said, right? At this point, with Omicron being domestically transmitted to a large extent, it doesn't look like it will add anything significantly. But there's no magic date from which on we would say, yeah, we should have done it then. When you look at what's happening globally, it was sort of one country after the other, lifting one after the other additional health measure, and every country felt different when that right time would be for them. As my colleague Dr. Carr said, we believe now would be the time for Canada as well.
And I believe this was touched on in French, but I'm hoping somebody can talk about it in English about masking. What is your position on masking in planes, whether it be coming into Canada or domestic travel as well, because there is a chance that masking could remain while other measures could be dropped by the federal government?
Yeah, I mean, I think the themes that we talked about here is that, we have mass immunity, we have access to treatments, we're a very different place in the pandemic that, people are, even the most vulnerable people have protections and are able to have even a benign outcome from COVID-19. I think in the context is what Dr. Mertz had talked about is, what's happening in the overlying society and the community probably affects more of transmission than, particular mandates, and including, things like masking. And, I think the third point is when we talk about flights particularly, this is a well-ventilated space. It's probably the most well-ventilated space any of us will go to who don't work in the healthcare system or don't work in particular industries. That has incredible air exchanges, incredible filtration, and it's a space where people have to take their masks down from time to time to eat and drink. And so, I think in the balance of all of that, it really starts becoming, a bit of a question of when masking can come down and recognizing that masking is down in the rest of our society outside of hospitals and certain other institutions. It's hard to kind of continue it along in travel without some defined endpoint or some transparent indicator to say that this is the point where it comes off.
And I think just to follow up on that, and I think as Dr. Chagla said, it's hard to know when the time. We're going to evolve in some point to a time where mandates no longer exist. And I think the other thing is people will make decisions. And those will be individualized decisions based on your own health. Maybe you're going to visit an elderly grandparent. That decisions about masking will soon become individualized, much like they exist in other realms of society right now. So I think we're moving towards that in terms of making this an individualized choice. I know there's lots of people who are going to mask on planes even when we eliminate the mask mandates, and I think that will be a very wise decision for them because we do know that good fitted masks of high quality work. And I think the issue is who needs them, and that's going to be individualized.
Ian Wood, CTV News. So you're here today speaking on behalf of the travel industry. I'm wondering, are there any other realms of society right now where we still have COVID, maybe not measures, but protocols, whatever you want to call them, that are still onerous on the public? Or is this really the last area that you're focusing on?
Yeah, I think this is probably one of the last major central ones that we have a lot of restrictions and mandates still on. We all work in healthcare. I think that's a setting where we want to take as much precaution as possible. All of us have to deal with COVID patients on any given day, and so having those measures in place, in that sector is probably very reasonable. I think as Dr. Carr had mentioned, a lot of this comes with risk and benefit discussions now in terms of, what is the potential benefits of keeping mandates in places that are still mandating, vaccines or outside of healthcare and other masking outside of healthcare. And what are the risks that come from it, right? And in things like in industries like schools, is there exclusion from school? And we really have to consider the impacts of that. And I think this is where we are in the pandemic, is that it's not as simple as saying global policies are needed for the goal of preventing COVID transmission in the context of widely available vaccines, in the context of 60 to 70% of Canadians already having had COVID-19. And again, outside of healthcare really is that discussion with particular industries that are still doing it about the risks and benefits and what's lost in maintaining these mandates.
So if this isn't good policy anymore, do you feel the government is just playing politics then with COVID at this point?
As I said, we're not here to discuss politics in the sense that it's a much more complex thing than science. We've tried to stick to a scientific method, and I can see that I'm not trying to dodge a question.
No,
I know what I'm saying. It's like, we're not politicians, but maybe we're acting like that in this now. But it's more that it's really a scientific answer. And there are justifications that are politically motivated that are much deeper than we appreciate. But scientifically, I think there's really a consensus amongst us and amongst our colleagues outside of this panel about the sort of thoughts that we've outlined in today's report.
And if I can just ask too, where do you see the greatest threat then with COVID-19 now? I'm wondering if you can where right now should eyes be focused on then from a government or from a policy perspective? on going forward? Where do we need to put more attention where we're letting off, or government is letting off?
I think it is where we already have our focus, which is healthcare, which is long-term care, where the most vulnerable people are. And investing in those areas is, to me, as a healthcare worker, much more important than testing international travelers.
Thank you, doctors.
That looks like it's the end of questions here on the floor. Are there any questions on the line? Over to you, operator.
Next question is from Sophia Harris at CBC News.
Hi, I just want to confirm, are you all in support of dropping the mask mandate, which the government has yet to decide whether it's going to do?
Again, these are difficult decisions. I would say, if it's looking around outside probably should match what we're doing in our airports. And if it's not, then there probably does need to be some transparency or an indicator to say when it's safe. I think at the end of the day, we are not going to be able to mask indefinitely in airports and on airplanes. And so, if it's not now, then at least some transparency in terms of when it is in the future. And considering, again, the level of immunity that we have, next generation vaccines, that we have therapeutics, there is a lot to say that the measures like masking, which do work, may not be as important other than individual risk decision making now as they were back at the beginning of the pandemic.
And sorry, just to follow up, so you're saying, at this point you feel it should be left up to the individual?
I mean, that's where masking really is in the rest of society, outside of outside of the airports, and it's outside of the airplanes, right? It's left to the individual based on their risk, based on how much protection they want, and wearing a well-fitted, well-constructed mask if they want an additional layer of protection. I think at some point we probably have to transition most of society to that point, and so that's pretty similar to the society around us.
So you're saying that the masking rules, should follow what we're doing in the rest of society. I know there's been issues about, disputes on planes with people trying to wear masks, saying it's hard to enforce. So do you think because it's not happening in the rest of society, that's what's contributing to the problems, and so therefore, it should be left up to the individual? I
mean, I think I would also, suggest that, us going to a Senators game, with 15,000 maskless fans is probably a bigger threat to COVID transmission than a well-ventilated, well-filtered space in that context. Again, airplanes have the air exchange system of some of our surgical operating rooms, and so I think again the benefits of masking, if they're not being enforced in society in some of these high-risk settings, they're probably there's benefit, but it's probably more marginal in the context of a well-ventilated, well-filtrated space. And again, this is where that transparency, if mandates are kept for masking, is what is the end indicator for that to align with the rest of society.
All right, thank you.
Next question is from Laura Osmond at Canadian Press.
Good afternoon, doctors. Thanks for taking our questions. I wanted to ask you, first of all, given your findings, what is your advice to United States policymakers, particularly when it comes to the U.S.-Canada border, where there is likely to be a discrepancy now that the government is leaning toward lifting vaccine mandates, but one still exists on the other side of the border?
Maybe Dr. Weiss, you haven't been on for a while. Do you want to answer that one?
I mean, listen, there isn't much discrepancy between the different jurisdictions, because at one point when you travel around the world, you see that things are more or less equal up to a certain point. I think what is important from the Canadian perspective is A, we're one of the most highly vaccinated population in the world. B, we have new vaccines coming, in the pipeline, bivalent vaccine that will certainly be, that already been available for Canadians. And we're strongly encouraging high-risk, Canadians with high-risk factors to get their shots. I mean, you cannot have a perfect lineup of all the different countries around the world in terms of their own policies. But I think we're here to try to make sure that the Canadian population can travel as much as possible without having too many risks doing so and not bringing any major issues in this country. And I think at this stage, with the tools we have, we've reached that point.
Perfect, thank you. I also wanted to ask, I know that, you mentioned you're not politicians. I'm wondering if any of you have any reflections on the role that politics have played in our border restrictions, in our restrictions at large in Canada, and maybe some of the value and some of the drawbacks to that.
I mean, I can start and my colleagues can join in. I think practicing over the last 2 years has been very interesting. I think infectious disease docs and emergency docs were not, in the media and not on the news and not talking about COVID and, living very, very benign lives. Again, I think there is the science, which is evolving and continues to evolve. There's the politics and policy. COVID has been everything for the last 2 years for our country and has affected so many lives. It's not easy to tease things apart. And, I think our politicians, even though, our report really does talk about the need to move on, have very difficult decisions every day. They have to support their constituents. They have to support their ridings. They have to support their parties. They have to, really try to develop policy that not only reflects science, but reflects social and economic and other pieces of the puzzle that physicians like us, unfortunately, don't really have access to in that sense. So, I think, again, no one's in an easy position in all of this. And I think everyone generally is on the side of making sure that Canadians were safe. And, we can talk about timelines and everything along those lines, but I think at the end of the day, evidence needs to evolve, and that really comes from the scientific evidence, but the trust from the politicians and others to evolve with the evidence in that sense. I don't know if anyone else has comments.
Yeah, I think we're all looking forward to a point in time where we can start to reflect and look backwards and look at what we did right and what we did wrong, and where has our healthcare system been left after COVID. And as a frontline emergency physician, to me, what keeps me up at night no longer is the risk of acquiring COVID or feeling not safe at work. It's about picking up the pieces of our healthcare system. And these are the challenges. And we can look back and we can assign grades to how we did. And now we're trying to look at where we exist in this space and moving forward through a deeper dive in terms of making sure we're ready to go forward and looking onwards.
Are there any more questions on the phone?
If I may add something on this one, I think we have to look forward on how to handle the next threats in terms of infectious diseases. And I think as Canadians, we have to make sure that whoever is doing anything in this country is ready to be part of the solution for whatever is coming next. Antibiotic resistance is a major issue around the world. We have emerging infections. Look at monkeypox, look at what happened. The good thing about all of this is, I think as Canadians in general, and this is absolutely not any political statement here, we're a lot better trained to tackle infection in the future. Everybody in Canada, like 2 years ago, masks were mostly for healthcare workers. Every single Canadian now can wear a mask and know how to wear a mask. So at least, people can test themselves for COVID. So if something happens in the future, everybody learned many lessons about how to react quickly to a potential infectious threat. And hopefully the next one will arrive one day, and I hope the country will be ready.
Are there any more questions on the phone, operator?
Next question, Tamara Ugolini at Rebel News. Please go ahead.
Thank you very much, everyone, for being here to give this much-needed scientific update. Repeatedly throughout the conference, I heard that the border mandates and restrictions were ineffective in preventing the variants of concern. And given that Omicron and the variants of concern arose during a time when vaccine mandates were being heavily enforced by the Justin Trudeau Liberal government, and now knowing knowing then that, at that time, unvaccinated individuals were being discriminated against and preventing from entering and or leaving Canada. I wonder what then the role vaccinated international travelers played on bringing Omicron and these variants of concern into this country.
So again, and I'm probably repeating myself here, I think it was reasonable at the time. Many things were reasonable at the time when they were implemented based on the best knowledge at that point of time. I think what we try to outline today is, in a situation where we have significant domestic spread of a respiratory virus, singling out international travelers isn't justified anymore. And I think that's the bottom line, vaccinated or not. We would have hoped everyone gets vaccinated. Some people chose not to. As we mentioned in our talk, I mean, one of the main reasons as to why we are where we are currently is the fact that many of us chose to get vaccinated. We are able to prevent severe disease, and that was one of the public health goals that we have had. And I would like to leave it with that.
Okay, respectfully, my question was about the vaccinated travels that may have been responsible for bringing the variants of concern into the country, but regardless, I'd like to just move on to a follow-up question. I was looking into the Canadian pandemic preparedness response plans that were previously established prior to 2020, and I heard a little bit from the doctors that they'd like to reflect and see what went right and what went wrong. And to that extent, why were all of the previously well-established pandemic response plans disregarded for these knee-jerk restrictions and mandates? And then how long will it take for the travel and tourism industry and sector to recover from the catastrophic failures of the Justin Trudeau Liberals with these unscientific mandates and restrictions?
So the second part of that question, I'm not sure, just because I don't work in the travel and tourism industry, but I will just say, COVID was very different than anything else I think we've dealt with in the past 2 decades. Really, since the 1918 flu, I don't think we've had a virus that's had this incredible transmission, that's had this variability in terms of symptoms, this very short incubation period, this huge level of infectivity, and really, being able to paralyze healthcare systems. As we saw, many of us were traumatized with what happened in January, February, and March of 2021, where there seemed like there was no escape from this. And so, I think this is where, many things came from, right? We didn't have the time to evaluate these tools in a randomized controlled trial and say that this was going to be an effective tool and this wasn't, because of the fact that if you were wrong, people die and healthcare systems collapse. And so, I think we're in a better spot now. I think we have a time to reflect and evaluate, similar to what we put through in this report, to look at the international data that was studied around travel and tourism, and put that in a single report and hopefully inform pandemic policy going forward in that sense, not only for this one, but the next one in that sense. So, again, this was a very different pandemic. I don't think anyone could have predicted, and it kept throwing curveballs every 5 seconds when we thought we had things under control. Again, it's hard to sit back and say that decisions were not justified at the time when we didn't really have evidence. And I realized the pandemic preparedness plan that came from SARS-CoV-1 dealt with a virus that had a very long incubation period, that had a very typical prodrome, that had, a limited transmission, although very fatal transmission amongst those who had it, and we all experienced that. But this was a very different virus, and it changed the game altogether. And I think that's, important to recognize in the context of all of this.
Thank you very much.
Quickly, referenced a report, and I wonder where we could locate that report.
Sorry, excuse me. The report is available on our website, which is timetotravel.ca. And I'm just going to move on to the next reporter, please. Thank you very much.
Currently, no other questions on the teleconference.
Great. Thank you very much. That concludes the conference.